You're watching CommonWell TV. We're in Orlando, Florida for HIMSS 2017. Hey, Scott Adams here with you, now being joined by MEDITECH's product manager, Stephen Valutkevich, one of our proud alliance members with CommonWell. And let's talk a little bit about advancements here in interoperability, maybe over the course of 2017 and even beyond, Stephen.
Sure. One of the things that we are excited about, I think, is seeing interoperability get to the point where it is commonplace. It's not seen as a challenge or a strategic advantage. Think about online banking, when you pay your credit card and that bank-to-bank exchange just happens. That's the assumption. We want to get healthcare and interoperability to that same level. So the idea of interoperability really is that not only should it become absolute, but it should be under the assumption that the data has always been there, so that the data sharing really does become natural and seamless. In essence, it becomes unremarkable. I mean, in the end, that truly is interoperability for the common good.
We talk about advancements. Now how about some challenges going to be brought forward here in the near future?
Sure. I think one of the biggest challenges we find is where people look at the ownership of data. And in the end, I think that's really in the patient's hands. From an industry standpoint, we use a lot of data in order to analyze it, in order to be able to report on it, in order to be able to make decisions on it. And that's all good and that's all important. But I think it's more incumbent to make sure that we understand whose data that really is in the end, and that is the patient's. So just as caregivers and physicians are obligated to provide the highest level of care, we as vendors and everybody in the healthcare community is really responsible for ensuring that that patient information is always there and always readily available. We think about the ONC pledge of giving consumer access, using standards and no information blocking, and it's a pledge that MEDITECH signed as well as many other folks, and we're living it.
Well, let's spend a little time talking about MEDITECH then, shall we? Interoperability affecting your customers' population health initiatives. Maybe expound on that if you could.
Sure thing. We look at it as you really can't have meaningful population health without being interoperable. You can't just stay within one EHR or within one repository. Healthcare has a vast amount of data, but it doesn't do anybody any good, and it certainly doesn't serve the patient if it can't be exchanged and it can't be aggregated in order to provide insightful analytics for better outcomes.
Talk about maybe value for your customers and how MEDITECH is able to really give them something above and beyond.
Sure, absolutely. We approach it from the standpoint of that we're also patients and we're also consumers. We get the frustration that data is siloed and not always readily available. MEDITECH offers very tightly integrated products that out of the gate work very well with one another. But at the same time, that is not the end-all be-all. Okay, you have to be interoperable and exchange externally. You have to be able to send and receive, and that's very important. And I think we see in today's day and age that the utopia, obviously, for any vendor would be that they have their system everywhere, but that's not the reality. And so rather than ripping and replacing, we feel that more of the value and more of the sustainability that's going to come within healthcare is being interoperable and making sure that these systems can seamlessly integrate back and forth. And we have a vast library of interfaces that are based on many standards. We have a dedicated team of folks who that is what they do and that is what they serve to our customers. And at the end of the day, we recognize that that interoperability has to happen internally. It also has to happen externally.
He's Stephen Valutkevich of MEDITECH, and for more information on what they provide, go ahead and log on to meditech.com. And as always, make sure you jump on to CommonWellAlliance.org for more.